I know clock is ticking. We have votes open, but there are a couple more questions I want to raise and have responses for the record. I'll try to be brief. The lack of access to healthcare in rural communities is a serious emergency. According to data tracked by the University of North Carolina, Chapel Hill, 182 rural hospitals have closed since 2005, leaving residents in those areas no options but to forego receiving health care or to travel long distances to see a doctor. Dr. Allure, in your testimony, you mentioned that the Veterans Affairs Hospital where you work is located in Marion, Illinois, a town with a population of about 17,000. You also mentioned that your hospital serves veterans from a number of states, including Missouri, Kentucky, and Indiana. Can you briefly describe what healthcare disparities you've witnessed in your work and how those disparities impact individuals living in rural areas in particular?
Thank you, Chairman Padilla. Our veterans come from 2 hours, 2.5 hours away, going past emergency rooms and hospitals to receive care at the VA. It's such a cherished institution. Once we get the veterans, we take care of what we can take care of there. It's a small hospital. The shortage in the community glares at us once we try to transfer veterans to places they need. VA spares no effort, energy, or expense in getting care to the veterans. And like I alluded before, hospitals are closed. Whoever is in the community, whoever is coming to a hospital for a problem is at an advanced stage because they don't have access to primary care, and that's a huge problem. The pediatrician I was talking about, who is established a huge practice there, he is having to recruit out of his expertise so that he can provide care. So he's recruiting psychologists, he's recruiting dental assistants so that that shortage is compensated. The disparities are projected to even get worse as aging physicians retire. So the outcomes are already poor. We have to act now so that we can arrest that decline and secure the rural areas.
Thank you. And if you don't mind, I'd like to ask a slightly more personal question, Dr. Allure. You've mentioned that moving a substantial distance away from work in order to put your daughter's needs first. You shared that in the testimony you submitted. You also mentioned the trials and tribulations that you and your wife have faced navigating our complex immigration laws. But yet, despite all that, you remain committed and steadfast in your passion for your work, the work that you do serving our nation's veterans. I'd like to thank you again for the work that you do in your service. And I just want to hear from you, what would obtaining a green card mean for you and your family?
Thank you, Chairman Padilla. One word I would say is stability. We've been working in the community, we've been living in the community, but we are not really part of the community. We don't belong there because we're still temporary immigrant workers. Stability to my family, to my children, especially my daughter who will age out if I don't get a green card in 6 years. Stability to my patients. Travel is a problem being on a visa. If I leave the country and if I can't come in, there is a gap. That has been the case with many immigrant physicians in our organization. Freedom from simple day-to-day restrictions like not able to drive. Right now, there is a physician in East Tennessee, a rural country. A gastroenterologist is not able to drive because of his visa problem. He's decided to relocate. His children and wife are already gone. He says he cannot take calls because he can't go to the hospital if there is a bleeder in the hospital. There is a liver transplant program director in Iowa City right now who is not seeing patients because his immigration process is screwed up. He's not doing anything since Monday. His patients are waiting. All these restrictions and problems we face are actually, they reflect on the patients, they reflect on the communities. One day of work I can't do is care delayed for many patients. Thank you.
Thank you. So according